The most interesting thing about the Affordable Care Act is it's actually giving people, for the first time, access into the healthcare system. And that may mean the first time that they're using a health plan, or it could be the first time that they actually have a family doctor. So it's a big change for these individuals. So the onus around customer centricity for us as an organization is to make things as simple and easy as possible for these folks that are accessing care for the first time or accessing care in a very different manner. So some of the things that we do at Cigna, we have been the first company for the last several years that offer 24/7, 365 telephonically. So you can access either our clinicians or our service representatives every day of the week, 24 hours a day, whenever your needs are there. In addition to that, though, we're also providing people access through the internet and the web where they can get the information that they're looking for, whether they want to know whether their physician's in a network, what's the cost associated with what's the quality, and then also recognizing that we live in a very different world now and everybody has mobile devices, so it's very critical that all the information that they can access through the phone with us, all the information that they can access on the web, they need to also be able to access with their mobile device. Now, once they've actually had treatment of services and post the treatment of the services, we go to great lengths once again with the theme of simple and easy. We provide them with an explanation of benefits, and this explains to them what services were performed, how much do they cost in totality, and what's their specific costs. So therefore, they have a very deep understanding of what their financial responsibilities are, but very importantly, what services were actually provided, all in the vein of making things as simple and easy as possible for individuals. Well, talking about why a health plan should banish the word member, I think we need to take a step back and even first look at a broader perspective. This is one of the most complicated industries, but on top of that, we've created our own language, or what I like to say, we have our own nomenclature, whether it's the terms that we use, whether it's all the acronyms that we use. It's very unique. And it's just not the health plans, it's also the delivery system, the physicians, and also the employers that are driving and providing employer-sponsored benefits. So think about, you think about people speaking English, you think about people speaking French, Italian, well, people also speak healthcare. So member in particular is a very good example. Cigna sat back and said, you know what, it's really important that we speak in plain common language, and in language that people understand and language that people use. And we term that phrase within our organization the words that we use. Well, member in particular has really resonated to the top as one of those key words. Why? Because member used to mean in our vernacular customer. But yet when you talk to a customer, they didn't understand what a member was, and more importantly, they didn't want to be a member. They want to be a customer. A customer wants to be a customer. So from our perspective, we've changed that word. We've taken it out of our vocabulary, and when we talk about the individuals that are the end users of our services, we refer to them as customers. To make it a little bit of fun, one of the things that we did a few years ago is we made this transition because we no longer call a customer a member, we call them a customer, and we no longer call a physician a provider, we call them a physician. Well, to have a little fun within our organization, we used to put a little jar in the middle of the table, and every time you used one of these words that we didn't think was appropriate and was reflective of everyday normal language, everybody put $1 in the pot, and I'm happy to say that we generated quite a bit of money, but the good news is now we've extracted that from our vocabulary going forward. Cigna's overall business strategy that we framed and we've driven our business through the last 4 or 5 years has been about going deep, going global, and going individual. If you take the last piece of that strategy, going individual, it really gets to the core of what we're trying to accomplish with each of our customers. So first of all, we want to put healthcare consumerism right in the hands of our customers. That's number one. Number two, we actually want to empower those individuals so they can pursue their goals and what's important to them. And third, we want to make it fun. So fun in terms of how we disseminate information, how we interact with them, whether it can be gaming, that type of aspect. What we want them to do is engage and have fun in their health. So when you think about the future, front and center for us is the aspect of really digital. And when you start thinking about digital and mobile devices, everybody has a phone now. Everybody has a mobile phone. And more importantly, people are using their mobile phones more and more for the different functions and how they live their lives. So one of the key things that we've done is we've recently entered into a partnership with Samsung, where we're helping in partnership with them for them to build out their S-Health applications that will be on all of their phones. And that will be, I believe, a very universal touch point for us, for which it will touch many, if not all, of our customers, but very importantly, it will enable them to leverage and address their personal health issues through the phone that they walk around and carry every day and use that's in their hands.